The story that I have to share is the story of so many others. The fact that our lives have changed. We didn't have time to prepare for the change. Our schools have closed, but yet at the same time, we haven't given up.
Good morning. I'm Dr. Rudo Benjamin. I am one of the hospitalist physicians here at Little Company of Mary Hospital here in Torrance. I am one of our board certified internal medicine and also a pediatrician. And I wear a lot of hats here. I have clinical responsibilities and see patients here at the hospital, but I'm also on the board of directors for Providence Medical Associates. You know, a lot of people of color work on the front lines. They can't work from home. Oftentimes they live in crowded living quarters and conditions. You know, their access to health care is a lot more limited. And so, you know, we know Black and brown people and Native Americans are affected disproportionately, twice the rate of others. The death rate anywhere from 1.5 to 2 times higher in certainly the Black community and even the Hispanic community. And so, you know, it's important we recognize that. There is a deep mistrust, I think, that exists amongst a lot of people of color when it comes to especially vaccinations and things of that nature. And so I think we, you know, sort of have to not only understand cause these disparities in healthcare outcomes, but also understand the history behind why there is such distrust, okay? And I think that the only way to combat that really is to sort of engage in a community-based approach, boots on the ground, leaders in the African American community, Hispanic community, you know, talk to our brothers and sisters and let them know that this is a safe vaccine, that this is going to save their lives, you know, that we're disproportionately affected when it comes to our mortality rates and the impact that this virus has had on the economy and how we're even more affected and disproportionately affected by that, you know, as far as the unemployment rate and access to economic prosperity and things of that nature and how it's affecting our communities in that kind of way. And so just keep the faith, be supportive, pray, do whatever you can, but also be aware of your own mental health, okay? Because you need to remain strong so that you can provide that love and support for your family member. And this has been such a trying time. And, you know, my sister, she's a psychologist, and we talk about, you know, mental health all the time. And she's even helped me kind of navigate the waters a little bit with my own stress that I've experienced during this pandemic. And it's just so important that we're in touch not only with our physical health, but also our mental health. And being aware of that and seeking out help if you need help.
I know that these times are hard for everybody. I know that we miss being with family, we miss being out with friends. Our children, you know, they're home versus being out and about with schoolmates. But I think it's really important for their health and the health of the community that we stay home and that we practice being safe. That, you know, our children are all we have and we need to be safe for them and for ourselves. So stay home, wear a mask, and we'll get through this.
You know, I was talking to, I remember this conversation so vividly. Unfortunately, this beautiful woman has passed on, but I was taking care of her sort of in the infancy of her disease before she got really sick. And she was an older African-American woman, and, you know, she just couldn't quite understand why folks were so codified in their self-righteousness and so unwilling to make the necessary sacrifices. Take this virus seriously. Protect yourself, protect your family, you know, empower this country to get back to where we were before this pandemic struck.
The faith, the end is near, the vaccination is coming, and like I mentioned, we already know what we can do to help slow the spread of COVID-19. I think some people have quarantine fatigue, I certainly do, but continue to put those health practices in daily use. Continue to practice your social distancing. Continue to wash your hands, not touch your face. Continue to wear your face covering. All of those things are helping us slow the spread of COVID-19.
I've adjusted to COVID the way many people have. I've realized that I have a larger skill set in technology than I ever knew I could develop. I've learned to have patience and to accept the reality that I'm currently, and many of us are currently that all of us are currently living in worldwide, and to take the time and enjoy this time that's been, by choice or not, granted to us to spend time with our family, with my daughter, with my husband. I remember that first week that school shut down in March, one of my staff members, two of my staff members quickly became ill with COVID. And while one seemed to be stronger and able to deal with the illness better, one of my staff members I was very concerned about because we were worried about what the outcome would be. There have been families in my school site who have lost loved ones. And the fact that my husband has had to quarantine twice has been very scary. And even within the isolation that we're experiencing right now, it was even more isolating knowing that there was the possibility that he had been exposed. The safety recommendations I would make to people are the ones that we've been hearing from our scientists and from our public officials. And it's the ones that we know that can help us stay safe or safer. And that would be wash our hands frequently, sanitize our hands. It would be to maintain a 6-foot physical distance or more between ourselves and others, would be to wear masks, cover our nose and our mouth. And I think those would be the recommendations that I make.
I'm really looking forward to hugs. I'm very physical in expressing affection, and that's been the most difficult thing for me, is not to have the physical contact with people. So I'm really looking forward to face-to-face contact, and I'll probably be giving a lot of hugs. I'm a grandfather, so I have 3 grandchildren, ages 7, 8, and 17. I have 2 adult daughters, and the reason why I follow the safety precautions is because of them. In the beginning, I didn't take too much into consideration the fact that it could affect, if I were infected, that it could affect them. I thought it was just about me, but it's not. It really affects the entire family and the entire community as well. So now I'm more sensitive, that I have a responsibility for my family to be in good health, to take care of myself, and also to set a good example for them, so that they can take all the precautions.
So Trini mentioned our Navajo elders who adopted Trini, and in the process the whole family. We've been over 20 years going to the reservation in Arizona, and they've been very sweet to us, and that family got hit with COVID, including her spiritual brother who is in Lompoc Federal Prison. But he's doing okay, and her spiritual sister. We also have Lakota friends, and we just heard that one of them just died, the mother of one of our old friends there, who I knew the father very well, just passed. And many of our friends we just heard in Chicago, because we lived many years in Chicago, 17 years for her, 15 for me. And some of our friends in Chicago got hit, but also this community, Pacoima, San Fernando, Silmar, is getting hit really hard. So a lot of our staff members have got COVID. Some of our board members, one of them had 9 members of her family with COVID. So COVID has really impacted us. Our people we love dearly are getting hit. We're doing good right now, but it's really sad to see that others are being hurt the way they are.
And the interesting thing is that all this has happened even with practices, with pretty, adopting really safe practices. So, it's kind of worrisome. And it doesn't mean to disregard the practices as if they don't matter. They do matter, but even with that.
So I'm looking forward to going out to eat and to be able to do it with other people. I miss my friends, being able to eat out with my family, getting together, that companionship. I'm really looking forward to that.
You know, we used to spend a lot of time with my sisters, with my parents, with friends, hanging out, you know, Friday nights and, you know, karaoke, having dinners. And so a lot of that stuff has had to just completely stop.
I want to travel with my daughter. We had plans to travel this year. I want to go to Oaxaca. Yeah, so that's been on my bucket list for a while. And this year I wanted to take her with me. So I've been purchasing some books so that way she can get familiar with the state and the city. And so that way when we go, she can connect and find, you know, some of the places and be related to the city as well.